So a lot of the things that you are talking about, and you've said it many times in our interview alone, is the atlas alignment. What is the most important function of an atlas alignment? Why does it go out of place, and why does it need what are the benefits of it being completely in place besides constant pain?
So when it comes to the atlas misalignment, there's several different ways or reasons why the atlas goes out of alignment. First of all, that's where we have the most movement. I'll bring my little model up here too. Can you see it okay? Can you see it pretty good?
Yes.
Okay. So this is the atlas right here. You'll notice that you've got the skull that sits right on top of it. And then there's no disc above or below it that holds it in place. The discs don't start until after C2 right here. It doesn't really start until there. So what you have is a web of ligaments that holds this structure in place, this complex right here in place. But that's where we get all of movement of our head. But because there's not a disc kind of anchoring it there, it makes it more vulnerable to damage, whether it be, a slip or a fall, sports injury, a car accident, whiplash injuries are very common, some sort of traumatic brain injury. There's no way you can have a head injury without having neck injury. It's impossible, physically impossible. So those are some of the things that can actually cause the atlas to go out of alignment. I mean, if you think about it, there really isn't. I mean, maybe somebody's never had a sports injury, a fall, a slip or fall as an adult, or a whiplash injury. However, just think about when we're learning to walk. On average, kids fall between 1,200 and 15 times just learning to walk. And how many times have they bonked their head, on the coffee table or, the hearth of your fireplace? It happens all the time. Kids fall out of bed. All sorts of stuff happens when you're learning to walk or just learning just to, just be a kid, just playing, all those things, the monkey bar accidents, things like that. So our body keeps score. There's actually a book that actually is called that. But what happens is that over time, all these little hits to the nervous system, to the body, to the head and the neck, they can create these issues. So that's why we really encourage, parents to get their kids checked. It's much easier to take care of, a child and get their nervous system functioning properly at the very beginning than it is to take care of an adult that already has had, decades worth of damage and degenerative change to help them. So if we start kids off right, their nervous systems are going to grow up a lot stronger. And a stronger nervous system means a stronger, healthier individual overall. So, I mean, I would say probably that the biggest thing is we see is the neck pain and the upper cervical region right here compromised because of that. That's what can cause a plethora of issues later on in life. Kids typically don't have a whole lot of pain, but lately I've been seeing 8-year-olds with chronic migraine. That to me is just horrendous.
Right.
So I want to stop that.
And it's a little things like that. Most people just take a Tylenol if they have a migraine or a headache, and they don't really understand or connect that there's an underlying problem that might need to be addressed. Greater than a pain medication for temporary relief. So it's so important that if you find yourself having these consistent and regular headaches or migraines or neck pain or backaches, that you go to a chiropractor just in case you might need a readjustment, because it is so common, and it's one of the things that people just put on the back burner and alleviate the pain with a temporary medication.
Yeah, and I mean, there's always a time and a place for those things. It's just that when you start getting on that roller coaster of constantly needing to take a pain reliever, whether it's over the counter or one that your doctor prescribes you, it's that roller coaster ride that you're constantly on. And I always tell patients, is it okay? Well, there is a time and a place for medication. I subscribe to that because sometimes you can't always get into your chiropractor.
Right.
So and you got to function for the day, or you're out of town or whatnot. But that should be the last resort. And when a patient finally understands what it's like to be in alignment, they understand the concept that, okay, well, I didn't have these headaches or these migraines, neck pain, low back pain, whatever it may be, because I had a lack of Tylenol in my bloodstream.
Right.
And that sounds rather absurd, but that's not, yes, that's something that can cover it up, just like, Analogies are really big in chiropractic because I think it's hard for people to understand that it really is that simple. If you consistently take, a drug to mask a symptom, that is the equivalent of putting, black masking tape on your check engine light on your car and
Right.
continue to go thinking there's not a problem. Eventually your engine's going to fall out. Well, I don't want anybody's engine falling out. I want to make sure we correct the problem so it doesn't continue to plague you in the future and you don't have to consistently rely on medications every single day for the rest of your life. Does that mean you're never going to have a headache again? We're human. Things happen. We get stressed out. We bonk our heads in the car door. Things like that happen. We are a dynamic living entity that is going to have incidents and accidents that could throw us back out of alignment. But we don't want to have that to be our crutch. And getting that word out to people that there is hope without medications is really important.